Now, Ghana is currently grappling with a cholera outbreak that has raised serious concerns among health officials and communities across the country. So far, 16 deaths have been reported, with 116 confirmed cases spread across 4 regions: the Greater Accra region, Eastern, Central and Western region. The Ghana Health Service is urging the reintroduction of COVID-19 hygiene protocols to help curb the spread of cholera. ChannelOne News' Enosafo has more.
According to the World Health Organization, cholera is an acute diarrheal infection caused by ingesting food or water contaminated with the bacterium Vibrio cholerae. The disease can cause severe dehydration and, in its most serious form, can be fatal within hours if not treated. Dr. Dennis Lai, Deputy Director of Disease Surveillance, Public Health Division, Ghana Health Service, says these deaths could be prevented if people seek early treatment at medical facilities.
Our concerns have had to do with the deaths. The numbers, yes, but also quite a number of them actually were brought in dead. So which means that they delayed in seeking care. And so I think about 7 or 8 of them were brought in dead. But the others as well, most of them spent less than 12 to 24 hours on admission. That meant that we had little time to be able to make a difference. Their kidneys may have stopped functioning because of the dehydration. So those are the very key things for us now, people having to report early. And we have seen some changes in some of the districts. So that is one thing we would want to let everybody be mindful of. That once you start developing symptoms, vomiting, diarrhea, watery diarrhea, get to the nearest health facility.
Cholera is preventable, but we continue to see outbreaks in areas with inadequate sanitation. ChannelOne News visited Osu in the Korle Klote municipality, one of the affected communities in the Greater Accra region, where residents shared their struggles with sanitation.
Osu jilane jame no eyemeke pipe yele angakula na ngane mwe nu jampo denche no ba ye akashi okanchi ise njema fe fale epo be pie ewa na ke no ji e koko me unfe lo nu sani enwe ke apa pie mi mwe fi ahun to no wa ke no ba fon amla lo yin ne kwakwa ne ke anwe pipe ami ke ni bi ne aka nu bo he ni nu no ka ko machine no kwa na yin ne ka majia ne ke helane na chiota ne ji koila ne ejo na je no shika nu en be fe be ne anwe pipe mi lo be fe be ne nu ana le bona atawo maka fale ele e ba kan shi be fe bi
epi ba eje na gbene wo toilet en ka fi wo na nu wo ka flagship ni yani wa chi obo le shu o ye enwe jame be fan kura ke akorila gbe ke bi ye jame aba ye ni ko la do be ba sonu le ba so adolo ba so ball anu ke ba so ni enu gbe ko ba ye ne ba ye fe ko fita ni amini korila no won pa fayi ke fi enye kwa won pa ban fa ohun ke fi eni mini le we ko jama wo because wo je enu ba ni wo ba yen ni wo ke flash wo toilet agbene wo eju wa wo because of nu e ba no won pa nye fayi wa ke fi nye bo amodin awo ko ni nye kwa wo ni yeli momi ke wo toilet ke wo nu fo mi ko ni bona fe ni won wo kana korila ko won pa nye fayi ke fi nye kwa wo jugba.
You go to the Osu beach right now. You see the flowing got over there. There is a mosquito over on it, which is not fair. The assemblymen are seeing it, but they are not working on it. So the way we want to tell the assemblymen, they should see the way the cholera is raising up again. So we are begging them, no more sickness again in Osu.
Dr. Lai also highlighted how poor sanitation contributes to the spread of cholera and urged the public to take preventive measures such as frequent hand washing and keeping their surroundings clean.
The factors that will drive the outbreak, they haven't left us. The personal hygiene, and then the food handling situations. They are still there. If people don't wash their hands with soap and water before eating, people are not eating hot food or warm food, if people are not washing their fruits and vegetables well, and it's not just washing, but also using clean water to wash, because if the water is dirty itself, then that is also going to result in somebody getting cholera. And the thing is that once we have cholera now, it means that the bacteria or the organism is in the environment. We know about our handling of waste. And so once we are not handling it appropriately, then the risk of the disease spreading is high.
The Ghana Health Service is advocating for Ghanaians to resume the COVID-19 protocols, that is, hand washing and the use of hand sanitizers. They would also like to remind Ghanaians that cholera treatment is free. Reporting for Channel One News, my name is Inu Safo.